Ji, Assalamu alaikum. Many times I just receive a question from very few new students. In fact, actually, doctors have very clear concepts about these things. They say, what are the blood thinning drugs? Look, there are actually no blood thinning drugs. It's a misnomer which is used like incorrectly, I must say. Look, there are two groups of drugs here. One are those which prevent the formation of clots, and one those which lyse the clots. The first one, which prevent the formation of clots, are divided into two big categories: anticoagulants and antiplatelets. Anticoagulants are those drugs which inhibit the clotting factors. Among them, there are three further groups: heparins, and we can also add unfractionated heparin, that low molecular weight heparins, deltaparin, enoxaparin, tinzaparin, fondaparinux even. And then comes the warfarins, the famous warfarins, which inhibit the post-translational modification of vitamin K-dependent clotting factors 2, 7, 9, and 10. While the heparins, they bound with antithrombin 3 and thereby inhibiting factor 2A and 10A. Then the third group in these anticoagulants is direct thrombin inhibitors, which are derivatives of the medicinal leech: lapiridine, daciridine, bivalirudin, and even a non-leech drug known as argatropan. And then when we come to antiplatelet drugs, those antiplatelet drugs actually inhibit the platelets. There are four groups in them: COX inhibitors, direct, aspirin, low-dose aspirin. Then the glycoprotein 2B, 3A inhibitors, apixaban, tirofiban, eptifibatide. And then the third one is ADP inhibitors, the famous clopidogrel, diclopidine. And then the last one, PDE inhibitors, which inhibit the formation of ADP from cyclic AMP, cilostazol, and dipyridamole. And then these were the groups which actually inhibited clot formation. Then the third group is thrombolytics, which will lyse the formed clots. Among them, the famous streptokinase, STK. It is a derivative of, or it is, obtained from group A, beta hemolytic streptococcus, known as Streptococcus pyogenes, as well as group C and G also. And then there are the tissue plasminogen activator derivatives: altiplase, ratiplase, tenactiplase. So in a short, nutshell, these three drug groups, in fact: anticoagulants, heparin, warfarin, direct thrombin inhibitors; antiplatelet drugs, COX inhibitors, glycoprotein 2B3 inhibitors, ADP inhibitors, and PDE inhibitors; and then thrombolytics, streptokinase, and TPA derivatives. I guess this summarizes all of them. Thank you so much.